everybody, Dr. Dane here, and May is Diabetes and Prediabetes Month. And this is a topic that you need to know about because there's a good chance that you or a loved one in your immediate family has diabetes or prediabetes. And the problem with diabetes is it's not symptomatic initially. So you don't even know that you have diabetes or prediabetes. It can only be diagnosed in a blood test. Now, the common blood test is called hemoglobin A1C that diagnoses diabetes. But in this video, I want to talk about what is diabetes. And diabetes is a disease where the blood sugar or your glucose increases in your bloodstream. And the reason is because it's not being metabolized properly. And there's a hormone that you've probably heard of that diabetics take. It's called insulin. And insulin is a hormone that's secreted by your pancreas gland. Your pancreas is a gland in the mid portion of your body that produces insulin. Now, when you're not eating a lot of sugar or refined carbohydrates, your insulin levels are kept low, okay? But when you're eating a lot more refined carbohydrates, grains, pastas, cereals, things that have a lot of extra refined sugar in it, like sucrose, what happens is when you eat sugar, your body responds by secreting insulin. And that insulin, the job of insulin is to take the glucose and then drive it into your cells so that it can be metabolized. So literally, insulin takes the glucose, drives it into the cell, and then what happens is your body will then convert that. Your body can only store a small amount of sugar. If you're an average person, you have about a teaspoon of glucose circulating in your bloodstream. Only a teaspoon, that's not that much. All the other sugars should be stored, and what do we store sugar as? Well, you guessed it, we store it as fat. So sugar gets converted to triglycerides, which is why you should know what your triglycerides are, and then triglycerides get actually stored as adipose tissue. We also store some of that sugar in our muscles and livers as something called glycogen. And what happens is we get a disruption in this insulin production, or your body becomes insulin resistant. So I had a patient this week whose insulin was 5 times higher than what it should be. In other words, he was putting 5 times the demand on his pancreas that it should be. Now, he didn't have any overt symptoms, okay? But when I looked at his blood work, his blood sugar was completely normal, but his insulin was 5 times higher. So guess what's going to happen? He's going to burn that pancreas out if he doesn't change something. And then what's going to happen when he stops producing insulin? He's going to become a diabetic. So in the further videos that we're going to do this month, we're going to talk about what you need to know, the lab tests, your diet, to make sure you're not becoming pre-diabetic, or worse yet, becoming a diabetic. Because when you become a diabetic, it will literally wreak havoc in your body. It destroys your nerve tissue. High glucose is a very damaging state in your body. So this is Dr. Dane for Wellness Solution Centers. Please go to our website and read our blog, our full blog on prediabetes and diabetes.